Shelley, I am really excited to have this conversation with you. As a mother, I greatly appreciate the research that you are doing. Tell us about your research with breast milk and breastfeeding. Can you tell us why this research is so darn important?
Oh yes, I can talk about this for a long time.
It's a big topic.
It is. Breastfeeding and studying breastfeeding is important because breastfeeding is recommended for almost all babies for the first 4 to 6 months. And understanding what is in human milk is probably the most important thing we can do in the whole field of nutrition, because it's how babies are supposed to be fed. And so everything around human milk and breastfeeding is really important to study.
Yeah, it's the foundation for the rest of their life.
It is.
Yes. All right, and let's talk though too about something very specific, because while you're studying breast milk, I understand that you focus a lot on this fatty acid called CLA that's in both cow's milk and human milk as well. And this plays a really big role for people. What are the benefits and why is this so important?
Well, CLA, it stands for conjugated linoleic acid, which is a mouthful, so we never say that. But it's a really interesting fat that happens to be found in cow's milk and beef, mostly. So as adults, that's where we get it from. But babies also get it from breast milk because it's made in the breast, which is really interesting. We got interested in it because it's an anti-carcinogen. It is the most potent anti-carcinogen that we know about in naturally occurring foods. It is also anti-inflammatory. And really interestingly, it's made in the breast, and so it's put into milk, and so breastfed babies get quite a bit of it. So we don't really understand this fatty acid very well yet, but I think there's a lot to learn there. The CLA research in itself is really interesting and important, but even more importantly, we accidentally discovered when we were studying CLA that milk has bacteria in it. And even milk produced by healthy moms has bacteria in it. We thought it was sterile. And so that has completely changed the game in terms of infant nutrition. We thought we were supposed to be feeding babies sterile things, and now we realize they're getting live bacteria from milk from day one. And so that really has changed the game for infant nutrition.
That's huge. Okay, so let's talk about the microbiome then, because you're also studying that as well, right? And I know some of us are probably pretty familiar with that term microbiome. It's a big word right now in health and wellness, right? But why is this also important for infants? Why should we care about the fact that there is bacteria in breast milk?
Right, so we know that whatever sets up the bacteria in a baby's gastrointestinal tract is going to keep them healthy as babies, and it's going to change their lifelong trajectory for health. So we're really interested in what's going on in those first 6 months. And when we found out, when we discovered at the University of Idaho that there are bacteria in human milk, like I said, it was a game changer because we thought this is what is setting up the baby for long-term health and well-being. Yeah.
Also, your research on human milk has actually had a global impact. Tell us about that.
Yeah, it has. I'd say most recently it was with the pandemic. When the COVID-19 pandemic hit, we did not know whether the virus could be transmitted from mom to baby during breastfeeding, and that's a reasonable question because HIV and other diseases like that can be transmitted. So we were lucky at that point to get funding from the Bill and Melinda Gates Foundation, the National Science Foundation, to study this, and luckily we found out that it did not get transmitted in breast milk, and in fact, breastfeeding women who had COVID produced antibodies to COVID and passed that on to their babies. So Mother Nature knows what she's doing.
In addition to all this research you're already doing, you now have set the stage for something even bigger and better because you just got a really great grant. Tell us about that.
We did. So our team at the University of Idaho just got a National Institutes of Health large grant, around $12 million, to establish a world-class entity at the university that will study women's health and nutrition. And so we're really excited about getting going on that grant.
Thank you.
Yes.
I'm just going to say thank you straight up because that needs to be researched so much. Looking forward to seeing what comes out of that. I'm just looking forward to hearing more about everything you've been doing. Such important work. Where can our viewers go so they can learn more about what you're doing up at the University of Idaho, especially when it comes to infant and women health?
Well, I think the best place is just to go to the website that's at the bottom of the screen. Go to the University of Idaho website and find us there.
You're making a massive differences in the world. I am so grateful. Thank you, thank you, thank you.
You're welcome.